My name is Drew Klein. I am a board-certified sexologist, and I am the president and clinic director of FocusWave Clinic. Welcome to the sexologist office. So what happens when someone calls us with ED? They call, we have a short conversation, we discuss their condition, we go through a few different factors. I'll get them to fill out the Mantality Index and see what their score is, and we'll bring them in for a free, no obligation with our registered nurse. It's the best place to start. So I've spoken with a lot of doctors, urologists who are quite frustrated with the existing system of scoring sexual health. There's two different scores. There's the SHIM score, which is the Sexual Health Inventory in Men, and then there's the IIEF, which is the International Index of Erectile Function. So the SHIM is like a 5-question questionnaire. It's pretty basic. It does not include a lot of the important information that's really required to determine someone's sexual wellness. The IIEF is a little bit more broad. It's 15 questions, but still not good enough. So in this frustration, I've developed something called the Mantality Index, and it's 72 questions, takes about 7 to 10 minutes to do. So what's important about the Mantality Index is that it's broken into 4 major categories. Those key categories are sexual health, mental health, physical health, and relational health. And then within those categories, we drill down even further. We can see in your sexual health what's going on with if you have erectile dysfunction, if you're suffering with premature ejaculation, if you have Peyronie's disease, or some other condition in that category. We can drill down even further. It's really important to figure out where you're lagging. Also for physical health, if your nutrition is suffering, if your lifestyle sucks, if you're not exercising enough. I'm sure you know the answer, but this will really pinpoint it for you. So for $1.99, you get a full analysis of your 72 question result. You get a score and try to get and improve those conditions over time. So some patients come in and they're taking 5-6 different prescriptions. They are what we call pill factories. A lot of guys are taking PDE5 inhibitors like Viagra and Cialis, and they ask, can we do the treatment while taking these medications? And the answer to that is yes, of course. One of the most important things we will do at the consultation is test your nitric oxide level. For a lot of patients, low nitric oxide is very common, and it's a very common symptom of erectile dysfunction. So if your nitric oxide levels are low, it's highly correlated with your age. We can boost those levels and possibly improve your condition, even improve the functionality of those PDE5 inhibitors that you're taking. Now, I'm not a big fan of PDE5 inhibitors. I'd much rather you go natural, take nitric oxide supplements and see if that can help you. I'm not a big fan of taking PDE5 inhibitors, just another pill to add to that factory. I want you to be on 0 pills. The healthiest guys I see in this clinic, 60, 70, 80 years old, taking no medication. Almost universally, those are the healthiest guys we see.